We're an organisation that doesn't look backwards, we look forwards, and the people you're going to meet are very much about the future and what that holds and the excitement of health and medical research. And I would ask you to think the next time you take any medicine at all, just think that took about 20 years to mature into the medicine that you got. Lots of research from places like this and others around the world. And we often forget the intensity of the research required for a new immunotherapy agent, a new chemotherapeutic, a new blood pressure agent, a new drug for diabetes. All of them come from places like this, burying their heads into discovery and wanting to make a difference. So let me just take you through some aspects of the Institute, just briefly, and very happy to answer any questions in a few minutes. And our vision, you might have guessed from what you've just seen, and I must admit, when I watch that, I always get tingles because I just love the whole feel of what we are and what we're trying to do. And we're obviously a group that's trying to do pioneering medical research, and I really like the fact it's got local focus and global impact. And we're Perth people, Perth doctors, Perth scientists trying to make a difference for the Perth community here first and foremost. And we're fascinated and passionate about discovery. People talk about translating things where you have to discover them first, and that's what we do here, and then we translate them into new diagnostics, new treatments, and new preventives. And so it's the answers that will give us hope. Now, this is a busy slide. I'm not going to take you through all of it. You can ask me about various aspects of it, but it gives you a feel that we're not just an institute that does science. We're an institute that, if you have a look here, I think this will work, we're about 450 people. That includes our clinical trials facility called Linear Clinical Research, and I'll mention one slide about that. We've got about 20 labs and growing rapidly, and you'll hear from a number of our lab heads today. We are generating a large number of papers that we publish. We are generating, we're winning grants and fellowships. We're involved with lots of medical assessments, 680,000 different assessments in our clinical trials facilities, and you can see 2,500 doses given in our clinical trials facilities. So we're very passionate about new drugs, new treatments, and bringing them to the community earlier. We're embedded in the community. We have lots of talks, lots of tours. We have consumer buddies that are involved and linked directly to some of our research. We've got an incredible bio as it were, it's a Lottery West biodiscovery laboratory. It's wonderful, and hopefully you'll get a chance to see that, and over 3,000 people went through that last year. And we have an incredible set of events, and we just had our ride 2 weeks ago that raised almost $5 million, and we have a wonderful walk for women's cancer. So that it's a very busy slide, but it's meant to give you a feel for all the things that are happening inside this very busy place. All of which are fascinating and passionate about. So we want to develop new ways to diagnose, treat and prevent disease. And along the way, we've clearly got a major role in educating the community and enrolling them in some of our clinical trials, both incredibly important. And some of you will know I'm a physician, I'm a doctor, I'm still working as a doctor, and we want to change and improve long-term health. We really want to improve and reduce the costs of healthcare. They're out of control in every single place in the world. They're out of control and costing all of us a huge amount of money. So controlling costs is important. Better research, better therapeutics, so-called precision medicine. I've got a 10-minute sign that Miriam's holding up there. I love it. Does that include the 3-minute video? Don't I get 3 minutes back for that? And we have passionate and informed supporters. And as you'd be aware, we can't do what we do without the involvement of the community. You're a central part in what we do. I do want to share this slide for you because it's actually it's a very telling one. And there are 3 figures on here, and each of them is about 40 years, okay? And there are 3 cancers here. And we don't just work on cancer, we work on heart disease and diabetes and rare genetic disorders as well. But this is about 3 cancers. And what we've got, brain, liver and melanoma. And the reason this is in here is because I want to show you what global impact means. If you look at the survival of either men or women in red and blue over about a 40-year period, you'll see for brain cancer, we really haven't done anything at all. And it's very depressing because this is a terrible cancer. The prognosis is awful, but we haven't really nailed it. We're not making an indent on brain cancer at all. Liver cancer is scary because men at the top there and women in every jurisdiction, and this is Australian data, this comes from out where we live, liver cancer is increasing rapidly and the death rate is incredibly high. But I want to show you melanoma, and we've just appointed a new chair of melanoma who's starting early next year, Jonas Nilsson. And this is what big changes in global health are. You can see melanoma, nothing was happening for 40 years, and then these new therapies came along, and for the first time in 40 years, there's a nice downward peak. That's what success looks like in health and medical research, and it's really important you understand that the scary nature of liver, the unfortunate, very depressing nature of brain, we've all got more to do, and the success of immunotherapy. Now, obviously immunotherapy and targeted therapies are being used in these tumours as well, but we're still not winning in all of those. So our research has to have impact. And I'm not going to go through a whole lot of science with you, but just very briefly give you an idea about some of the impact at the discovery level. We've got fabulous scientists working on the worst type of breast cancer, so-called triple-negative breast cancer. We've got people who are working on novel ways. That's okay, ladies. Nice to see you. We've got some of our scientists working on ways to improve the blood flow and improve the therapy getting into cancers. We're using machine learning, artificial intelligence, to predict readmission to hospital when people have had heart failure. We're looking at, and again, you've got to do the 3D imaging because it's wonderful, and you'll get a feel for what a single cell looks like, because we can deconstruct cancers into single cells, look at the genetics of single cells, reconstruct the cancers again, and come up with new therapies. It's an enormous capacity and fidelity. We've got new ways of treating liver cancer. Thankfully, maybe we can have an indent on that graph I showed you a moment ago. We've got an amazing trial that's being started soon by Professor Nigel Lang on preconception screening, thinking about the genetics of couples before they have a child and the implications of potential transfer of genetic disease in that couple. We've got a wonderful group working on a handheld device in breast cancer that Christabel Saunders and our team here are working on to improve the surgical margin definition for women with breast cancer. 1 in 4 women who have a breast cancer removed, 1 in 4, have to go back for a second operation because the surgical margin wasn't quite right. They didn't get all the tumour out. So just think of the thousands and millions of women every day having a breast cancer operation. We're trying to reduce that by a very special tool that our bioengineers are developing with our surgeons. And lastly on this slide, there's a wonderful trial being done by Professor Peter Thompson, who's looking at taking an old drug, colchicine, used for gout for 50 years, and repurposing that as a new drug to treat heart disease. And there's a huge clinical trial soon to be finished, and if that works, we've taken an old drug and made it into a new drug and reducing heart disease. So look, I'm very happy to talk about more of these at the end if you'd like me to. So what about the clinical impact? So we've talked about the research impact. Well, what about the clinical impact of what we're doing? We own and run our own clinical trials facility. It's wonderful. It's bringing new medicines first to Western Australia. It's digitally run. It's got a staff of 130. We're about to double it in size. It's growing incredibly to 60 beds. Lots of cancer clinical trials. Patients in Perth get cancer therapies, often the first in the world, and we're very proud about that because we can deliver for our cancer community new options and new potential therapies. And lots of patients, over 350, have received new therapies via Linear. So we're very proud of what we can offer the community in cancer. Another clear example of clinical impact is the fact that Perkins now runs, on behalf of the state, the Melanoma Advisory Service. Right here, patients come into our second floor clinical consulting suite, and then they are discussed in what's called a multidisciplinary team meeting. There's an oncologist, a radiotherapist, a pathologist, a dermatologist, all working together to actually give the patient the very best treatment metaphorically, the patient's in the middle of the table and all these consultants sit around the table and think about the best outcome for that patient. It's called the Western Australian Kirkbride Melanoma Advisory Service. We now run that on behalf of the state. I won't go through that in any further detail, but it's a wonderful, wonderful advisory service, headed up by Professor Mark Hanakiri. So what about our education impact? 5 minutes, thank you, Miriam. Our education impact, we have, as I mentioned earlier, we've got a wonderful Lottery West Biodiscovery Centre and over 3,000 workshop attendees last year, or this year, in 2019. Over 100 schools providing kids for us, numerous community groups. And we have kids who come every week for 10 weeks called Perkins Profs. These kids, from little tiny guys, but mainly from years 10, 11, 12, they walk out every night with smiles on their faces. They are uplifted by doing science. And this is science. This is so-called STEM, science, technology, engineering and mathematics, but the A being the art and doing it in an incredibly enjoyable atmosphere with young scientists who are stimulating young kids at school and the community as well, but predominantly young kids at school. They could be the new Nobel laureates, and that's the reality. And that's what we want. We want children in our community to be spurred on and enthused and inspired by science. It's wonderful. We have donor programs, and for those of you who would like to be involved, you're incredibly welcome. As I said earlier on, we can't do what we do without you, so we have a whole lot of potential offerings. We have the monthly giving club called The Spark. We have the Silver Linings, and Anne McClyber's here, and there's a workshop straight after this if you're interested in thinking about leaving a gift in your will. And we have workplace giving. So the Institute is very attuned to all aspects of donor programs, and we invite you to be involved if you'd like to be. We're in the middle of doing a couple of community surveys at the moment for our donors who we know. We've asked them very recently, and some of you may have been part of this cohort, what are the cancers that have touched them and their family most? And we have a very good understanding of those, and they're probably breast, melanoma and bowel, but some others, of course, in real terms. But this is the group of people we know, and we've asked them. We've also got a larger survey on at the moment, and some of you may have received this in your mailbox in the last week or so. 50,000 and have gone out via the mail, and 110,000 in newspapers. Again, asking you about cancer, what concerns you most, and what concerns you, of course, helps us guide our own research. And there's also a campaign on Facebook. So both our donors we know and people who are involved in the Institute and those who we don't know have been asked about cancer in the last little while. And we're looking forward very much to being able to share those data with you, because it'll inform us. We have incredible community events, and some of you may have already been involved in these community events. 10 women, a number from here, went and hiked on the Great Wall of China and raised $50,000 or more than earlier on this year. The Perth Radiological Clinic, or PRC, their staff raised almost $40,000 in a step challenge during the year. And the Perth Running Festival, you may be aware, is a new entity as of last year and this year, and we're the major, so as it were, charity beneficiary of that. It's a wonderful day for families who either running a marathon, half marathon, or walking, and it's fantastic. So the community is involved in a number of our events, and we love it. And then there is, we've lost a picture there. So on the right-hand side of this slide, unfortunately, are a bunch of riders, and maybe they've decided they're so tired after the ride they don't want their picture. But 2 weeks ago today, about 1,000 riders rode down to Mandurah, and there was this huge sort of party atmosphere down there. And then after a sleep and a glass of wine or whatever, everyone got up and rode back. And 2 Sundays ago, I just need you to remember, it was an incredibly hard day. There was a northeasterly all the way against the riders, including me, and it was 36.5 degrees Celsius, and it was 105 kilometres, and it was very tough. But 2 minutes. But the faithful, as it were, over 900 people did that, and we raised $4.98 million. And so that's the community's involvement and investment. And I could not believe on the Saturday night, talking to a group of 1,200 people, if I'd asked them, would you ride 105 kilometres into a northerly at 36.5 degrees? I'm sure they would have said, no way, Peter. But they got up and did it. So, that's the community involvement and spirit. We also have an incredible walk for women's cancer earlier on in the year, usually around May, and this year we had 480 walkers and $870,000. And these funds are incredibly important to help us do our science at world-class levels. Again, I can talk about how we use those funds in the Q&A in a moment if you'd like. So this is my last slide, and this is about you. And your involvement here, your participation today, your friends, your colleagues, your families, you help fund our work. It's as simple as that. We get funding from the government, we get funding from multiple sources from our community events, but you help fund our work. It's as simple as that. You help support major initiatives such as equipment. We're trying to raise money via a crowdfunding initiative for an incubator, as you'd know, in the last couple of days. We recruit world-class staff. Our melanoma chair is a world-class person coming from Gothenburg in Sweden, and he'll be a fantastic new addition. You come along to events like this and listen to all sorts of talks and get involved. You inform our research, and I've got to say that again, you inform our research. We listen to what you say, and the feedback is incredibly informative to us. And we've got lots of volunteers out there. You'll notice there's lots of people who are just coming along because they like what we do and they want to share their time with us. And in fact, we have a number of volunteers who come along every week and just spend a day in the Institute doing some of the many different things we need to do. Some of you may have or will take part in linear clinical trials, and the best of all is you're some foot soldiers and advocates for us, and you tell the story. And you tell the story tonight when you're at a barbecue, or tomorrow when you're sitting having a cup of tea with your friends, that you came along to the Perkins, you felt the passion, and you would like to be involved. And by the way, stop, it says Q&A time I've got for Miriam, so that's enough from me. So look, thank you all very much for coming along. The rest of the day will be, I'm sure, incredibly enjoyable, and that is my signal to stop, and I'm very happy to answer any questions that any of you might have. So thank you very much.
So what is the Perkins, or how does the Perkins decide which areas to conduct research?
So I've been the director for 5 years, and I took over, and from the video you saw Peter Clinton, who's a great, wonderful colleague and a great person to work with, and Peter was the first director before me. So when Peter became the Chief Scientist of Western Australia, which he is, some of you may know that, and I took over the directorship of this, what we spent quite a lot of time doing was thinking about what we were going to focus on and what we were not going to do. You can't do world-class research if you're trying to do everything. So we formed 3 divisions, and those divisions are cancer, cardiovascular and diabetes, and rare nerve and muscle genetic diseases. 3 areas. In the cancer area, there are lots of cancers. We decided to focus on what we call solid tumours. They have a poor prognosis, that means poor outcome. They are globally relevant, there's lots of them, and there are very few treatments. So we narrowed down our research in cancer. That meant we weren't going to be doing much research in leukemia and lymphoma, for example, but we were going to be doing research in the solid tumours, poor prognosis, globally relevant, and very few treatments. So brain, head and neck, triple negative breast, the worst type of breast cancer, liver cancer, pancreatic cancer, widespread prostate, and melanoma. Okay, so a small number of tumours with a critical mass of people working together and trying to make a difference. In the heart and diabetes area, that's we call sort of metabolic medicine. That includes types of heart attacks, but not, for example, rhythm disorders in the heart. And some people present with funny rhythms in their heart, and they need to have their heart restarted or nuked, as it were, just briefly to change the rhythm. We're not looking at rhythm disorders, but we are looking at the cause of vessels that clog up and produce heart attack. We're very passionate about that. We are interested in the muscle after a heart attack and how you can sort of regenerate that. We are very interested in predicting when someone might have a heart attack based on sophisticated imaging of their heart arteries. So that's another area, and diabetes, of course. And we have a wonderful team who look at rare muscle and nerve disorders. And interestingly enough, when you look at the rare disorders and you package up all the rare disorders in medicine and medical research, they make up about 15% of all disease. So studying rare disorders such as muscular dystrophy, motor neurone disease can provide insight into other neurological disorders and can be very informative, and has been. So from that perspective, we've done a lot of thinking and we've narrowed down into 3 very clear divisions, and we're very keen to pursue that.
How does the Institute decide whether to follow a science which is a new science, and perhaps synthetic biology is a good one?
Yep. So I think that we have researchers that come with very broad expertise, and what we know in medicine, if you're very blinkered, you're going to miss a whole lot of opportunities. And the example of repurposing a drug for gout to a drug potentially to stop a heart attack is poles apart. But if you don't keep your horizons broad, you're not going to pick up some of those opportunities. So as Miriam says, 2 of our researchers are working in an area called synthetic biology, and they recently got a large grant earlier on this week. And the work they're doing, they're trying to do some very sophisticated inside the cell reprogramming of the cell. So, for example, they may be able to resensitise infections to antibiotics. And you might know that resistance to antibiotics is a huge global problem. It's actually the elephant in the room that no one's looking at because the drug companies aren't funding much research. So you can use very skilled techniques to redesign the cell to overcome resistance to various antibiotics. Very, very exciting area of so-called synthetic biology. So we have people in the Institute who've got that skill set. We have biomedical engineers who come from engineering, who approach vessels like a pipe in Woodside. But the flow diagrams and the flow algorithms they use are exactly the same. So the flow in our coronary arteries, our arteries of the heart, are much the same as a pipe for Woodside, and we're using that skill set to actually help us answer some of those questions. Similarly, the design of the handheld probe to go inside of breast cancer, that's an engineering set of principles to allow us to look at the surgical margin, working with doctors for a clinical problem. So I think the answer to the question, Miriam, is we have multiple people across the Institute with varying expertise, and the complementarity nature of that allows them to see and be ahead of new concepts. The other thing, of course, is that that relates to new equipment and new purchases. The genome, for example, our genes inside our cells is a very rapidly expanding area. Diagnostically and so-called precision medicine, we're all going to have our genomes potentially done in the next 15 or 20 years. Will that help us? We don't know yet, and there's a lot of learning and thinking in that whole area, but it's exciting. The other thing, of course, is that we're an institute that has and embraces technology. We love new technology because that needs to be applied actively and in an innovative way so that we can better prevent, diagnose and treat disease. And I can see you've got the little stop chart up there, which means I've run out of time. So unless there are any other burning questions, thank you all very much indeed for coming along. Enjoy the rest of the day and have fun and be inspired by what the wonderful team here are doing. So thank you very much.